I had my first IBS attack at age 9. All of a sudden, without warning, I had the worst pain I'd ever experienced in my life. Just like this lower abdominal, I thought I was dying. It felt like somebody had just like plunged their hand inside me and was trying to rip out my guts. And I couldn't breathe, I couldn't talk. I came to and was face down in the dirt. And the pain was gone, but I was very cold, I was very shaky. I was sort of in a cold sweat, and I went to go see my pediatrician, who was just absolutely horrible, who listened to what had happened and said, "Your symptoms don't fit anything I've ever heard of, so there's nothing wrong with you." And her exact words to me were, "Quit whining." So for 7 years, I just lived with it. When I finally did see the gastroenterologist, he said, "You have diverticulosis, and here's some prescription antispasmodics, and you'll be fine. It won't kill you." When I was about 29, then I went to see a different GI doctor and said, "I don't think I have diverticulosis. I don't think I've ever been properly tested for other disorders, and I think I have IBS. But I would sure like someone who's a gastroenterologist and a professional in this field to second that opinion. What do you think? I don't want to just decide this on my own and self-diagnose after 20 years. And it was a great guy, he was a great doc, and he listened and he said, "Well, you certainly don't have diverticulosis. There isn't a 9-year-old in the world that would have that. You should have been tested for celiac, so we'll do the blood screen for that now. You should have been tested for inflammatory bowel disease like Crohn's and ulcerative colitis." And he said, "At this point, honestly, since you have no red flag symptoms and nothing has progressed in the past 20 years, the odds are overwhelming that it is IBS." Finally, 20 years later, I was officially diagnosed with IBS. IBS in general is diagnosed by its symptoms, and you have to have lower abdominal pain or discomfort in association with bowel dysfunction, which can be diarrhea or constipation or alternating. And people really run the spectrum, both the pain part of it, whether it's extreme pain like mine. I found out later I'm a pretty extreme case. So if I do get hit by that pain, there's usually diarrhea as a part of it. And sometimes in the aftermath of a severe attack, the next day it'll flip to constipation. And I think it's just my gut is so out of whack at that point. I think when people are dealing with doctors, the most important thing is that they get a proper diagnosis. You can't self-diagnose IBS. You have to have tests to rule out disorders that can mimic IBS, plus your symptoms have to fit the Rome criteria. So learn about that yourself, learn what this is, and if you don't think you've been properly diagnosed, see another doctor. Find one of the good doctors out there. There are plenty of them. There's great GI docs. It might take a while to find one, but it's worth it. Once you have a diagnosis, there's not a lot doctors can do for you. You can self-manage it. You have to self-manage it and self-control it, but you can't self-diagnose it.